All right. Hi, everybody. Robin Strongin here with Health Dame. And today we're going to be talking about a really important set of issues that is rural health. And I'm really pleased to have Christine Hamp with me today. I'm going to introduce you, Chris, in a moment. Chris is president of the National Grange. And for those of you who may not be familiar, we're going to learn about that as well. Today's topic is really a kickoff to a series that Health Dame is going to undertake on rural health because I would have to hog up all of Chris's time for the next couple of weeks if we really wanted to do justice. There's such a wide array of challenges. And at the same time, there are also programs that are working well. So this isn't only about what's not working. I think it's really important, as we always do, to remember that a lot of people are working really hard despite the challenges to make sure people are able to access high quality health care. It doesn't mean that it's not getting harder and harder to do that, but we do want to shine a light on the people that are working under tremendous stress to get things going where we know they can be and absolutely must need to be, because as we're going to hear, lots of crises when it comes to healthcare. So, Chris, before we hopped on, we discovered that we could not be further apart of where we were growing up, but yet we're coming together to solve some of these issues, or at least shine a light on them. Chris hails from the western part of the country in Washington, right, on a dairy farm. Am I correct about that? And I'm from Brooklyn, and I just actually learned as an adult that there were different kinds of cows. I didn't put together that there are dairy cows and meat cow. I just learned cow. And so there you go. You were elected president in 2023, but you're a fourth generation member of the Grange. Do I have that correct?
I am, right. Which means that my great-grandparents had been members and, of course, grandparents and parents, making me a fourth generation, which is something that this organization has a lot of pride in, is that legacy of long-standing membership. But also, we recognize that the most important thing walking through our doors right now are new members.
Yep.
And it's a great place for everybody to come together.
Are your members younger and younger these days, or is it across the board?
Yeah, no, I think it's across the board. I think we've, membership in a lot of ways. There's, a lot of members stay with us. Different from many organizations, they say with us for life. In fact, we just presented a lady with her 90th consecutive year of membership
Oh my
recognition.
God.
Consecutive years, 104 years old,
That's
and as a young teenager, and just received that 90-year award. But the new members that are coming in the door are first generation members, right? They're folks that have found that what the Grange is doing at the local level is of interest and is something that they want to get involved with. And so it's finding that way to mix that longevity and that legacy member with those new folks, and making sure that succession planning is taking place, and
sure.
and that we're preparing.
Wonderful. So at its core, it's been around since the late 1800s, and you've been doing this, well, not you personally, but the Grange has been doing this work for a good long time. And healthcare is one of the major areas of focus for
For
Grange.
almost 100. Yeah, we've been at this for almost 159 years. December 4th is our birthday, and
Wow.
it'll be 159 years on the 4th of December. And so yeah, we've been doing it for a while. And I think as we talk about healthcare, it's interesting how you soon start talking about some other things as well. Like, one of the new things that we see with healthcare, for example, is telehealth, right?
Sure.
But telehealth only works if we have a connection where you and I can talk like this, and that I can speak with my doctor or my health provider. And there's so much of this country that does not have this sort of connection, that we can't utilize telehealth. So when you bring folks to the table and talk about a solution that includes telehealth, it's a tool that
Is not completely reliable all the
it's not
time.
for everybody, right?
Right.
I can't pick that if I live in Portland. Right, right, so and then, there's things about the postal service changing some of their things where it takes a day or 2 longer because of having to go to a regional sorting facility. Then my medication
Sure.
to be refrigerated or kept at a certain temperature. By the time it works through that, it may be past the length of time that cold pack works, right? And
Yep.
and is it
Yep.
gonna be viable when it arrives? And so there's healthcare, but it also extends into these other things, and you're like, "Well, what is our policy is as wide as the room because we're focused on rural America." And so all of these things affect rural America. Healthcare and education and transportation and connectivity, all of these things together make sure that we can have these communities be the place that we want to live and that provide us with the resources to be able to do that.
Absolutely. And I know that your organization puts out some pretty terrific reports, which we will have linked on the website so people can reference them. But I'm going to take a minute because in doing some of the research, you guys point out that about 20% of Americans live in rural areas. And since 2005, more than 180 rural hospitals have closed. 35 rural hospitals closed since COVID. And as of today, more than 700 rural hospitals are at risk of closing, which is 23%. And 2.3 million people live in areas considered ambulance deserts. I did not realize that. 29.7 million lack access to level 1 and 2 trauma centers within 60 minutes. So that's pretty staggering, not to mention what we're going to do a little bit of a deeper dive. Mental health services, maternity and delivery units are closing, and on and on. I know that since COVID, things have been particularly dire. What's been going on since COVID that you're noticing? Oops, are you able to hear me?
Yeah, it's difficult to kind of yeah, I can
Okay,
hear it.
great.
It's difficult to zoom in on the exact impacts,
Sure.
from COVID, from research that's been done that it took a heavy toll in our rural areas, both with severe illness and with mortality. The effects of long COVID are, I think, still being figured out and what that looks like and how that's treated. But again, it's access. It's having those rural care providers in those areas to be able say these signs and symptoms are from COVID. Here's what you need to do to survive, to get better, to all of those different things. Like our local grocery store never missed a meeting. They transferred from a in-person to this sort of a meeting where they could look each other in the eye and make things happen and they found ways to continue to serve their community. They
Hmm.
were they were nimble, they were able to react to what was thrown at them. And so rather than that monthly meal where people would pack into that Grange Hall and sit down next to each other. They did it as a drive-through, and so they were buying clamshells, and they were putting their meals in a clamshell, and people were pre-ordering and driving through
Oh,
and
wow.
taking dinner home in order to support that Grange, and many of them, those funds that they raised in that manner were going to things in their community that needed help during the time of COVID. So people and Granges, adapted. They made things happen. Others weren't able to do that quite as well, and we know that some of them are just kind of getting back up on their feet and really back to a cadence that they were used to pre-COVID. And it's but I think it all comes back to the access issue with being able to, I don't know, to say that the sign or the symptom that I'm experiencing is something that can be treated, and not just because I had another birthday, right? Or
Right.
not just because, something else. And we see that all the time where, I'm on a medication and I look at the list of side effects and I'm like, well, shoot, that discomfort is a side effect. And then something else starts bothering me and I'm like, oh, well, that's a side effect too. And then all of a sudden you're like, wait a minute, I do have something else going on, and it was just it is a side effect, but this is actually something
It's
new.
more than that.
So
Yeah.
and so there's a lot of this where, we're trying to figure out, and it's incumbent on rural America to grab that chair and to pull it up to the table and to be a part of those conversations to say, look, folks, you can't continue to make policy. You can't continue to do these things for rural America without having rural America at the table.
100%. Way back in the day when I worked at GW University, we had something called the National Health Policy Forum. And one of the most important work that we did was to take the people making policy and legislation from Washington into the communities, because their heart could be in the right place about what a community needed. But if you didn't understand that when it rained, the road washed away and people couldn't get through, if you didn't understand that there isn't at that last mile a connection with technology, if you didn't understand that it takes 60 minutes to get to a dialysis center or a cancer center, or God help you, a NICU if there even is one, then the policy you're making is meaningless. And coupled with that, there is the policy wonk problem of a lot of the loopholes. And I know we have one of your reports on, see if I get this right now, it's the dual classification. So essentially what happens, even though the rural hospitals are so financially fragile, Congress did make some arrangements for additional funding, but urban hospitals are using an administrative loophole to classify themselves as rural, siphoning off money from the rural. So there's a lot of trouble going on. I know Health Affairs also did a study and posted. I know you wrote an op-ed on this whole issue. So there are some very important regulatory and reimbursement policy issues that need attention. There are severe worker and workforce issues. And as you said, it all wraps up into access. The intent is there. People want to stay healthy, but we all have to be working together to figure this out. And because of the nature of rural America, the challenges are really daunting, actually.
They are, and the numbers that you read for rural America are a best guess because
Ah,
everybody uses a different definition.
interesting.
And if you're looking at Health and Human Services, if you're looking at HUD, if you're looking at, which is Housing and Urban Development, if
Hmm.
you're looking at the U.S. Department of Agriculture, everybody has a different definition. And I guess I like to say we know it when we see it, right? I mean, if this community is rural, and you're right, there's, if folks would spend as much effort solving the problem as they do finding these loopholes
Right.
that are in holes where I don't think that was the intention ever,
No.
right? It's just there's a missing link to connect something, and in that gap, boy, they took advantage and have made it a freeway. And you're absolutely right. The largest, most well-funded facilities in America, some of our largest teaching healthcare facilities are able to call themselves and take a large chunk of those funds that should be supporting our truly rural hospitals that you see when you're driving through a small town, and they're not a high rise. They're usually one level, and there's a drive through for the local ambulance, and there's a front door, and that's about it. But that's what those communities have. And you use the term desert. We're hearing that word. It's kind of one of those new buzzwords that we're hearing, whether it's a food desert, whether it's a desert for healthcare. And it can be specific to cardiac care, it could be specific to mental health care, it could be specific to maternal care. You know, there's this space that you've got to go X far to get that help because those specialists have left our rural communities. They're following the money. They're following where those if the hospital leaves, so does the workforce, right?
Yeah.
And so we're no longer able to get that. And then all of these, and so people are like, well, I don't get it. Why is cancer worse in rural America? Why is diabetes worse in rural America? Why is almost every health diagnoses worse in rural America? Why are the percentages higher? It's because of access. It's because, let's just say I'm this of a rancher, and and we're raising some kids, and we've got our elderly plus, and we're trying to make it work with what we're able to
Hmm.
generate on a ranch. And if all of a sudden mom or myself or one of the kids has a sign or symptom that would should get checked out, you kind of push it aside. Let's see if it gets worse. Let's see. And then all of a sudden when it gets worse, we're not at stage 1, we're at
Right.
stage 3 or stage 4, right? And so the mortality rate is all of a sudden, higher because we didn't find it soon enough, or we choose not to go to get that dialysis done every day, or we choose
Because it's so far
not to
away.
refill that prescription because the pharmacy's finding you gotta go an hour or more each direction, and then I'm not home driving the truck that we need to as part of harvest, or I'm not
Right.
chasing parts, or I'm not picking up kids from.
Yeah. It becomes a trade-off, and it's a deadly trade-off, and it isn't even a question of convenience. It's just not there. And these are not simple conditions to have to be dealt with. These are lifetime chronic conditions that require ongoing treatment, and it's just a tough road for the whole family to have to figure out how to make this work. It's it's really something, and I
Well,
do.
and being
Go ahead, say again?
I'm sorry. I was gonna say being raised by generation after, of farmers, right? You're raised in a situation of rub some more dirt on it. I mean, it wasn't you weren't gonna take time to go to town to get a couple of stitches. It was, wrap your sock around it, rub some dirt on it, and we've got hay to get in, or whatever that was. But that's the mentality. It's that silent, just pull the bootstraps up and keep going. And I'm not going to make an announcement in Grange or in church or at the high school band concert that I was just diagnosed with something.
Right.
You do what you got to do, and that kind of leads us into the mental health arena of, even if there is a a local practitioner that could help with that, there isn't a there isn't a rural person in America that wants their truck to be seen outside that office, right? And to
Absolutely.
announce to the town that I've got an issue that I need help with. And so that's the other piece
Barrier.
of this is,
Yep.
how do we address it? We've got an amazing partnership with a group called Rural Minds, and I would think that Rural Minds and Jeff Linton is their founder, and he would be a great person to have on to
Oh,
chat with
great.
more about what's going on with rural America. We're very much engaged in the efforts that they're undertaking, and wanting to make sure that the resources are provided. I mean, that's what Grange has done also from the get-go, is provide information, is to educate our members, to educate our neighbors on, for example, let's talk about vaccinations.
Yes,
The
let's.
Grange does not take a standee that you should or you shouldn't, right? But here's the best science, here's the information, and then you can make a decision for you and your family based on what you want to do. But here's the best stuff. Just like a candidate forum, right? We're going to
Sure.
invite every candidate they're a D or an R. Here's what the candidates have to say. So again, it's an opportunity to inform and educate the community. That's what we're going to do. And so in a lot of our events, we have a lot of medicals that are available for folks to pick up and take home, and they can read at their leisure, and they can make those connections is the best we can do, and just to try to keep our eyes open and stay connected. And that's the other thing that Grange does and that Grange did throughout COVID to back up to that is to stay connected, is to make sure
Sure.
that somebody's not there on their own without somebody checking on them and feeling like they're a part of something bigger. We talk about that all the time about why join Grange. Well, to be a part of something greater than just you,
Yes.
right? For all
Yes.
the reasons that we've talked about, if you want to save your rural community all by yourself, that's a heavy, heavy lift, Robin.
Yes.
But
Yes. I can imagine.
if you can do it with all your Grange member friends, and then what we do better than anybody is we partner, right? We find those other organizations that we can connect with in order to expand the influence and expand the reach and expand, we're multiplying our experiences and our expertise across greater number of people to make a bigger difference. That's what Grange does, is bring people together, expand that experience, and then go conquer the world, right? Go make this
100%.
what we want it to be. Yeah, what we want it to be.
Yeah, yeah. I mean, every state has a rural area in it somewhere, so you're everywhere. You're just everywhere. And before I let you go, because I know we were talking about you have an awful lot to get done, I always ask everybody to please give me a song that best reflects the work that you're doing so that we can add it to our playlist. And then again, for people who don't know, the reason I do this is my husband loved music. We both love music, and I've done a lot of work with music and the brain. And before my husband passed, he died early of Lewy body dementia not too long ago. We always listened to music. And so, as a legacy to him and the work I'm carrying on doing, we're putting together a music playlist because why not? Music is good for not just your brain, but your soul, I would say. So, with that backdrop, what is the song for the Grange and for you, Chris, that we can add to our playlist?
Well, I could not imagine a playlist of anybody anywhere not having Eye of the Tiger.
Yes, exactly.
We have the Tiger, of course, that's a Survivor song from 1980, 1982. And there's nothing like 80s rock. I'm dated myself, but
Yeah.
that's the sweet spot.
Love it, love it, love it. And you know what?
You
We don't even have it on there. So I'm glad you are bringing it to us because that's a must have in my mind as well. So,
about when they talk about the thrill of the fight,
yes,
it's that determination, that rewards. Just that's what Grange is. That's what Grange does is that's why we're here almost 160 years later
yeah,
doing all these amazing things. It's that resilience, it's determination to make sure that these that we stand on that have been around and for this organization from the get-go still make a difference, still resonate today. And we're doing everything we can to make sure that folks know we're still out there, and to make sure that we start expanding into some of those communities that currently don't have a Grange. Maybe they used to, maybe they never have, but every community, and it's not just rural. I mean, that's our sweet spot. But Granges are in urban areas. They're in suburban areas, and I think that makes sense for any place. I mean, picture this. Picture standing in the coffee shop and overhearing a conversation behind you about a house fire last night where the Smith family lost their home and all their possessions. Where if I'm a member of a Grange, I could get on my phone and the group app where everybody's linked together, and I could just say, hey, the Smith family on, Route 2 or whatever road or whatever street lost their home last night. Who wants to take the lead on gathering some stuff up, and you can do that quickly. I mean, that's called hyper local, right? I mean,
Yes,
that's
absolutely.
meeting the need on the spot at the minute. Everything about that is just pure, beautiful, what Grange does. And that can happen as easily in Capitol Hill on
Anywhere,
Lofty
anywhere.
and in rural upstate New York, right?
Yep.
So that's what we're looking for. That's the energy and the vibe that we're looking for, that we can maneuver and be flexible and meet the needs of today. Yes, we know all of this cool stuff that we've been involved with back here, but my members would be sad if I didn't use the windshield thing with you here. But we're going this direction, right? We're looking out the windshield, not that tiny little rear view mirror.
Yep.
That's where we're looking for folks to join us, is out that windshield, working together to solve these things and to make sure that tomorrow's better than it is today.
Love it.
Every single.
Love it. And please count Health Dame as being in that driver's seat with you looking out the windshield. So, we have a lot of work to do. And to your point about partnering, I don't think we'll get any of this done if we don't continue to partner intergenerationally so that we share the wisdom of what's in front of us and how people move forward. I think we need to listen to what young people coming up are thinking about and helping us to keep moving, let alone forward. Yeah.
Absolutely. That Grange is very much intergenerational. I mean, that's really one of our secret weapons
Yep.
is, there is no place else where um today's family where, maybe you've got a parent that's moved back in with you, maybe your kid has boomeranged back with their spouse and their
Yeah.
kids. So guess what? All of a sudden you've gone from one generation in your house to four generations
Yeah.
in your house.
Empty nest to suddenly the nest is overflowing.
And then that local Grange meeting is a place that everybody load up the car, grab a hot dish, and go to the local Grange meeting. And every single person there has a place and something that they can be engaged in. I think that's super important. I think that's something that families need to know that we provide and that they're going to be looking for, is something that they can all do together. They don't have to leave one home with the kids, or they don't have to leave somebody home to keep an eye on mom. Everybody can go together and
That's amazing.
participate and be welcome. Yeah,
That's amazing.
absolutely.
It's very hard to find that. It really is hard to find that. So, wow, thank you. I've learned so much, and we'll be back in touch with you and your team, and we will follow up. I will reach out to Jeff at Rural Minds. Thank you for that. That's going to be really important. And we'll keep up the eye of the tiger. We'll keep fighting the good fight together, I hope. So, yeah, rock on. All right. Well, wonderful to talk with you today. Thanks for taking the time, and I will be in touch. You have a good rest of the day, and I'll get you the tape and everything. Thanks a
All
lot.
right, sounds good.